My name is April McClain Delaney, and I'm the Congresswoman for Maryland's 6th District, which includes right where we're standing. It stretches from here in northern Montgomery County to Mountain, Maryland. And my priority and the priority of all of these elected officials who you'll hear from is really the health and well-being of families, not only here in the 6th District, but across our country. This facility, which is the Upcounty Regional Service Center, and others like it in this country stand out as prominent community symbols of government. And government's, the shutdown and the impact that it has on health facilities. 20,000 members in my community, which include many parts of rural Western Maryland, depend on the vital health care and social services that take place every day in facilities like these, from SNAP to Medicaid to daycare and dental. And this is truly an unbelievable one-stop shop that is a model for so many and services over 2,000 people a day. What we've heard from patients, providers, and program administrators alike is what we've heard for months from our constituents, that they are worried about the short and long-term consequences of this administration's cuts to Medicaid and the Affordable Care Tax Credit extension and so many other vital programs that support the health and well-being of our residents. In my district, 1 in 7 Marylanders rely on Medicaid, and 1 in 3 are children. More than 30,000 of my neighbors are expected to lose Medicaid coverage under the Republicans' plans, and we cannot allow this. Our children and our families deserve better, our dedicated federal employees deserve better, and our state and community workers deserve better. That's why my Democratic colleagues, and I also lift up the Democratic Women's Caucus, they've decided to show up here and highlight these issues. And while we will remain in Washington and in our districts over this next week, listening to our constituents, we remain committed to working with our colleagues to restore essential services, to reopen the government, and to rebuild the trust voters have placed in us. And we cannot let this shutdown break us. And I must say one last thing. I represent over 35,000 government workers in my district. These are workers who show up each and every day, regardless of party, to lift up the public interest and all of our well-being. So now I'm pleased to turn this over to the head of the Democratic Women's Caucus, Congresswoman Teresa Leguera Fernandez, who will speak more about the shutdown and its disproportionate impacts. I also want to lift up our county executive, Marc Elrich, and Dr. Bridgers and Ruben Rosario of this facility.
Really want to thank you. This was such an amazing visit. I want to thank all the people who make a difference, for the families that show up I think it's 2,000 that show up every day here, and they know that when they leave, they are going to have health care, they are going to have insurance, they are going to have their needs listened to and then addressed. And that's why we are here today. I am chair of the Democratic Women's Caucus. We are 96 women strong, and when the speaker gets around, which he should have done yesterday and the day before, to swearing in Adelita Grijalva, we will be 97 women strong. 97 women strong. And we wanted to make sure on this, we are 12 hours in, 13 hours in to a government shutdown. We wanted to make sure that we spoke to the federal employees here in Maryland. And thank you for acknowledging them, Representative, because indeed, in every one of our districts, we have federal employees who are dedicated public servants. I always say that to serve is an act of love, because we know these public servants, whether it's law enforcement, whether it's military, whether it's Social Security, whether it's at IRS, whether it's at the Park Service, whether it's in any of the federal offices, they do it not for the money, because we don't pay them enough, but rather because of love of community and of the people they serve. So that is where we first want to say is we understand how hard this is. But the other question that keeps getting asked is who's to blame? And I think that that's very clear. The Republicans are presently in charge of the White House, the Senate, and the House. And their failure to work with Democrats on approving a budget that we know has to be done every year by September 30th, you know who has failed to govern. But a question that we wanted to ask, and why we are here, which we think is even more important, is who will feel the pain? We know who's to blame. But more importantly is who will feel the pain if we do not stick to our guns and stay in the fight to make sure that we restore health care coverage to all the people who have lost it, that we make sure that we lower the cost of health care premiums so that as people are opening the envelopes and opening their emails and seeing, as one small business woman has done in my district, that her premiums are going from $604 a month to $2,300 a month. And she is going to have to make the choice between shutting down her business because she cannot afford to pay 36% of her gross income on health insurance, or having food on the table. And here we have heard over and over again how when families show up, and the families who show up to care for them, that people get the services they need to stay healthy, to stay employed, to stay fed, to stay nutritious, to make sure that we have babies that are born that are healthy and beautiful. And that's what they are doing in this facility, and we thank you for it. Because we know, we heard today that 75% of the people who come here for services are women. And all of these cuts that Republicans are proposing and that they have already done and taken advantage of are women. And so that's why we have come here today, because we know that when people open those envelopes and open those emails, that they will know that those health insurance premiums that have gone through the roof are because Republicans refused to work with Democrats to address the health care crisis. And I really want to think about Gracie, who we just met in there. Gracie, oh my God, she served, I believe it was, I might get this wrong, but I think it was 35 families with this concept out of her garage. And now they are serving 5,000 people, and that is what happens when you have the love and the faith of one person caring for her community. And I think what you see here today are hundreds of people, and across the country, hundreds of thousands of people who want to care for their community the way that Gracie has done. And thank you, Gracie. Muchísimas gracias por todo el amor y toda la ayuda y toda la comida y toda la salud y toda la inspiración que nos ha ofrecido a nuestra comunidad. Muchísimas gracias. And I now want to turn it over to a member of leadership who is here all the way from California, Nanette Barragan. Take it over.
Well, thank you. I'm going to be brief. I want to first thank Congresswoman Delaney for bringing members of Congress here to this one-stop regional facility. This is an example of what is at stake and what the fight is right now in the shutdown. This fight is about health care. This fight is about health care. And this fight is about health care. And I'm saying that over and over again because Democrats are fighting to cancel the cuts that were made to Medicaid. This facility here enrolls people in Medicaid. It gives services to people in Medicaid. We saw the dental chairs that provides dental care. We talked to people enrolling those in Medicaid. We saw and talked to people who are providing food assistance and distribution, fresh fruits and vegetables that are keep families healthy. All here, and those are the kinds of services that are at stake with cuts to Medicaid. we're also fighting to lower cost. This administration said they were going to lower costs on day one, and what's happened? Prices have gone up. And now we're talking about healthcare prices. Why? Because our colleagues across the aisle do not want to come to the table to talk about healthcare, and they certainly don't want to talk about keeping costs down and your premium for the Affordable Care Act down. That is what this fight is about. It's about saving health care for the American people. And this center is the model of what is at stake and the services that are at stake. And that's why we're going to continue to fight. That's why we're going to continue to stand together. I thank the county executive, all the council members that are here, all my colleagues. We got to continue to make sure we are in this fight for the children, for our families, and for everybody. Thank you so much.
Hello, I'm Congresswoman Emily Randall, and I represent Washington State's 6th District. And I'm honored to be here today and to have come into Congress alongside your representative, April McClain Delaney. We came to Congress to work for our neighbors, like the neighbors who are served in this incredible facility, like the neighbors across my district who are impacted by healthcare needs regardless of who they voted for president. Folks, 50% of the families in Washington State have babies born covered by Medicaid. That's true across the country. It's true for Republican families and Democratic families. Aging parents and grandparents who need assisted living care and help navigating onto Medicare need that health care regardless of who they voted for president. My colleagues in the Democratic Caucus came to the table to work for people, all people, regardless of if they voted for us, to access health care. American people deserve quality health care coverage. They deserve to walk into a facility like this, fill out one form that shows that they qualify for help, for assistance, for medical care, for food assistance, for housing assistance, not have to fill out form after form after form to prove they're poor over and over and over again, but to walk in one door, to get access to support and services, and to be able to build a stronger future for themselves. That's what the American people deserve. That's what this facility is offering. That's what my colleagues and I are here fighting for, and that is what is at risk in this shutdown. Our Republican colleagues are putting their political power and motivation ahead of the fight to protect healthcare and social services for American people who are just trying to get by, who are seeing today notices go out that their premiums are spiking double or more. They're worried about their local health centers and rural hospitals closing. And in communities like mine, that means that an hour-and-a-half drive to the hospital might turn into 2.5 hours if the one road that exists to get there isn't washed out by a storm. We are facing a healthcare crisis in our communities, and yes, the system could be better, but it is not going to be better by ripping healthcare away from millions of Americans and closing facilities like this that are keeping people healthy and giving little babies and families the start that they need to thrive. I'm going to keep fighting alongside my colleagues for everyday Americans to ensure that we have the support that we deserve, that we should be able to rely on our federal government to deliver. And I represent 27,000 federal employees, so just like this district, I know what's at risk, but I know that the risk to our healthcare coverage is even greater. So we'll keep fighting. I'm proud to be here today. Thank you so much. And now I'd like to pass it to Montgomery County Executive, to my colleague, Marc Chicano.
Thank you. Again, thank you to your amazing Congresswoman, April McClain Delaney. Amazing. Thank you. Congresswoman Delaney shared with us this amazing one-stop shop where, Montgomery County residents can come who have lost their job, who need health care, who need to find a job, who need basic food assistance. And that food assistance comes with great dignity. You may be somebody driving a fancy car on lease, but you've lost your government job. And that last paycheck is not covering your family's needs, and you can come here with your head held up high and know that Gracie and her team are going to get you food that your family needs. This is an amazing place. The cruelty that we see in Washington is greatly contrasted with the compassion that I see here in April McClain Delaney's district. It's such a compassionate place. You're so lucky to have an amazing, amazing county and staff and citizens here. But you know what I want to talk about? I am the ranking member of the Veterans Affairs Committee. I authored the Honoring Our Pact Act, which was the largest expansion of veterans benefits in a generation. And you know, the Republicans have dishonored this pact that we have with our veterans because they did not, in this CR, account for the advance appropriations that we need to do to fund the toxic exposure fund that pays for these benefits that we approve. But let me take it down. That sounds very abstract. Let's get down to the fact that the 35,000 federal employees that live in this district, 30 to 35% of those federal employees are probably veterans. And any cuts we see to the federal workforce, 1/3 of those are going to be veterans. The huge, huge, huge challenge and suffering we're going to see because of this Republican shutdown, 1/3 of those federal employees are going to be veterans. But the big ugly bill, when it cut Medicaid, and it's going to shove 15 million Americans off of Medicaid, 10% of those Medicaid recipients are veterans. Not every veteran gets their care at the VA. 20 million veterans in this country, about 10 million veterans are service-connected and are eligible for care at the VA. But you know what? We still have a lot of disabled veterans who need to go to they need to go to their state and get Medicaid for coverage. The 19 million Americans who depend on the enhanced premium tax credits that Marylanders who use the Maryland Health Exchange, Marylanders, Californians, those that need those premiums. Teresa talked about that letter that went to her own constituent, and that constituent's premium is going from $600 to $2,000. That's triple. That's triple. That is not an unheard of jump. I'm seeing the same thing happening in California. I guarantee it's going to be happening here in Maryland. That is what's at stake now, this year. People are going into this enrollment period facing these dramatic premium increases. That's going to result in huge numbers of people without insurance. They're not going to be able to afford that health insurance. That's going to mean a huge strain on Montgomery County's emergency rooms. Healthcare costs are going to rise for everybody else. Nobody is going to be unscathed by this healthcare crisis created by this administration and Republican policies. That's what's at stake in this shutdown, and that's why we're fighting. We're fighting to cancel the cuts, lower the costs, and protect healthcare. Healthcare is the big, big thing that is driving this crisis. And I just want to say thank you to April McClain Delaney one more time and turn it over to the Montgomery County. Oh, excuse me. Stephen. To Stephen Horsford, my colleague, the former chair of the Congressional Black Caucus.
Thank you. Thank you to the ranking member, Mark Takano, for Veterans Affairs, and to your Congresswoman, April McClain Delaney, for organizing the opportunity for members of Congress to join with your local officials and the community to really put a spotlight on what's at stake. To the chair of the Women's Democratic Caucus, while I'm not a member, I'm an ally. And we're all in allyship because we have one objective, and that is to save health care. The shutdown that we're now 13 hours into, caused by Donald Trump and the Republicans who control the House and the Senate, did not have to be this way. We could have had a bipartisan approach that funded government and saves health care. I represent Nevada's 4th district. My district covers 50,000 square miles from central rural Nevada, 5 tribal nations, and a part of Las Vegas and North Las Vegas. Like your Congresswoman, it's a very diverse district, and it requires that we are working hard to keep community resources, particularly health resources, available to everyone who needs them. The Big Ugly Bill, as has been stated, was the largest cut to health care in the history of our country, $1 trillion. Those cuts were not only to Medicaid, but they were to our entire health care system. Now, on top of that, the expiration of these enhanced premium tax credits, and I want to be absolutely clear, these are not subsidies. This is not an entitlement program. I serve on the Ways and Means Committee. We are using the federal tax code to help middle-class working families get tax relief so that they can afford health care. Republicans made it a priority to give tax breaks to billionaires that they didn't even pay for, that added $3.5 trillion to the debt, but now they don't have the time or the priority to give tax relief to hardworking Americans so that they can keep access to affordable health care. Speaker Johnson canceled votes this week to deny the minority the opportunity to bring our amendments to the floor and to have a bipartisan approach. And that is why this Republican shutdown has occurred. So on behalf of the constituents that I represent in Nevada, on behalf of the 1 in 5 Black Americans who are enrolled in Medicaid, on behalf of the children and the families who are going to be impacted unless we restore these cuts and lower cost and save health care, we're here to show up, to speak up, to stand up, and to fight back. That is our objective right now. We will show up and listen to the people who are most impacted by the policies that this administration is pushing through. We will speak up on their behalf. We will stand up for them, and we will fight back every step of the way. Thank you to your Congresswoman for allowing us to be here today. And now you're up.
Getting multiple introductions is fun. First of all, Congresswoman Delaney, thank you so much for putting this together. Look, and I want to say I appreciate all of you being here from the delegation from the Democratic Women's Caucus, because what you're doing is putting a human face on what's happening in Washington. People think this is, a numbers game. And I just want to emphasize, when you think about the effects of tax cuts or less tax cuts to billionaires will cause them no pain. If you're a billionaire, it's kind of hard to cause you financial pain. It's just a little less money that rolls into your billions. Their tax cuts take away key services from residents, not just in Montgomery County, but all across this country. Every district, every sector of the population is going to be harmed by the tax cuts that are going to billionaires and the money that's not available to spend on health care, on housing, on the insurance. I'll also add in NIH. You're crippling medical research, something that we all rely on, crippling that to give tax credits to billionaires who don't need the money. It is unexcusable. It is not the right way to do things. All of us who are in the government know we got to make difficult choices sometime. But I can tell you a choice that we don't make. We don't make a choice, do I fund things that people need, or do I give tax cuts to incredibly wealthy people? That is not a choice we should be making, at least not on the side of giving the cuts to the incredibly wealthy. We need to be helping the people who need help. We were elected to help people. We've got the ability to help people. We're going to keep doing that. I am so glad that you are fighting. This is not something that's going to go away quietly, and I appreciate everything you do, and we're going to stand behind you. It makes a difference what you're doing. Thank you so much.
I'm going to take us home. Thank you again to Congresswoman McClain Delaney. Thank you so much for being here. My name is Kate Stewart. I'm the president of the Montgomery County Council, and I'm here with my colleagues, Councilmember Balcom, whose district we are in. Councilmember Albanaz was here with us. He's the chair of Health and Human Service, Councilmember Katz, and Councilmember Lori Ann Sales. And we are just here so thankful for Congresswoman Delaney for bringing her colleagues to us today. This is a hard road that we are on right now. And for the last 10 months, Montgomery County has stood shoulder to shoulder with our state representatives, with our federal representatives to weather this storm and to fight back against this administration. And we are going to continue to do that. And today, you have had the opportunity to meet the folks who are doing the work day in and day out. And I want to just say, as people said, this is about healthcare. This is about people's lives, the individual, everyday people in our community. And whether you're from Nevada, Washington State, California, or here in Maryland, in Montgomery County, each story resonates, and each one sounds so similar to another one. And that's the power of these stories and the work that we are doing. And I just want to say thank you to the staff who are here, everyone who works here, because it is not only providing services, but it is how they are doing it. It is about providing services with dignity and respect for people. And I want to say that what this administration is doing is so cruel. As we know the saying that how a society treats those who are most vulnerable is a sign of that society and that community. And here in Montgomery County, we treat people with respect and dignity, every single person, and provide those services. And we're going to continue to do that with the wonderful partnership we have at the federal and state level. And we're going to push back on all of these cuts and do what we can for our residents here in Montgomery County. And so thank you very much for highlighting all of this today. Thank you.
So I think we are going to wrap this up unless we have any questions afterwards. But I just want to say, Marc Elrich, thank you for being the county executive you are that leads with heart. Thank to all of our council members. Thank you so much. And I must say, I neglected to say that we have representatives from both Congressman Raskin's office and also Senator Alsobrook's office. And so there is really, I think, a combination of federal, state, and local level officials all working on this together. And I, this morning, actually started my morning on the Capitol steps in Annapolis with Governor Westmore, our Lieutenant Governor, and our much of our Maryland congregation. I feel like we need to have a congregation and a lot of prayer. Delegation in terms of, that we all have to cross-leverage and work against and mitigate all of these terrible cuts and what's happening in this time, but also that we have to collectively work to reopen government, because that's what we need to do. And, I have been here before, but this Upcounty Regional Service Center is a model for our country in terms of what they do. And I lift up all of the people here who work here each and every day, because they really impact lives. So thank you all. We have to save, I'm going to say it again, we have to cut costs. We've got to save our health care, and we've got to scale back these terrible cuts and make sure that we really protect the safety, health, and well-being of all of our the people who live across this great country. And thank you to you all for showing up. I love each and every one of you.